Good afternoon, all the delegates and the faculties. We have a very short introduction ceremony, and after this, we will again be resuming our academic session. So, first of all, I'd like to thank all of you again for having an overwhelming response for this event, and especially our thanks to the management and our director, Dr. Pavan, who has been a visionary in taking pulmonary and its allied branches to a higher level. And all this couldn't have been a possibility without our director as well as our seniors who have been very supportive, especially Dr. P.N.S. Reddy sir and Dr. Raghutam Reddy. And I'm a student of Professor J.C. Suri, like I got trained from DM in Saftajang. That is when I really got a little bit of awareness about sleep, and that is what we are trying to take it forward. So with this brief introduction, I would request our director, Dr. Pavan, to say a few words and to inspire the young people here to take pulmonary and sleep as a specialty forward. Over to you, sir.
Thanks, Vishwesh. Wow, on a Sunday afternoon, I'm amazed. People are not sleeping here and concentrating and like listening to sleep talks. So that's great. But you can sit. Yeah, that was wonderful. We thank all the dignitaries on stage. Special thanks for Dr. J.C. Suri. Or Vishweshwaran was always telling multiple times the source of his inspiration was real teachers. He's here. Dr. Vijay Kumar here must have inspired a lot of students to take pulmonary and sleep medicine, and Dr. Vishnu sir and all of our pulmonary Dr. P.N.S. Reddy sir in Chest Hospital has inspired many people to take pulmonary medicine. Dr. Raghutam here and all the dignitaries here. People look like from all over the country, well represented. So pulmonary looks like the most advanced field. Like all over the country, people are well networked, and people are thinking I'm favoring pulmonary a little bit just because I'm a pulmonologist. But I'm saying no, that is not it. Now even in my admin hat, pulmonary has a great future because it covers everything from influenza, COVID, to regular asthma, COPDs and all. Coming to the topic of interest, sleep medicine is just positioned to take off well. Like previously when I was doing MD general medicine in Manipal or something, I think people were saying pulmonologist is what is that only tumulu dagulu and cough and sneezing and all, but it's changed a lot nowadays. The kind of advances in like intervention pulmonary and ECMOs and all these things is COVID. Nowadays all malaria and like typhoid, cholera, these kind of things are, I don't think people are seeing anymore in India. So nowadays it's only influenza, COVID, SARS, some kind of virus or the other will be there. So pulmonologists will always be busy. But yes, what intervention pulmonary was a few years ago, like before going to US and all, 2009, I hardly knew about what was intervention pulmonary and all. But after coming back from US in 2018, now I know that intervention, a lot of advances have happened. Many people from US also are coming and training here, so that's great. So I think sleep medicine is also positioned for the next big takeoff, I think. As you all know, like this, if people are sleeping today, so I think don't feel too bad that sleep is the most useful and beneficial thing. So never try to cut down on sleep. So as a lot of research was done, I think I'm sure like how many hours of sleep is required? Is sleep really required? Is it enough to get by 2 hours, 4 hours of sleep or something like that? But after a lot of research and all, if it was sleep was not useful, then nature would have got rid of sleep. We are spending 1/3 of our lifetime in sleep, and also it's extremely important for survival. So other than genetics, I think the most important determinants of longevity, I think I'm sure as you know, is maybe calorie restriction, exercise, but equally important and a little underappreciated is good quality sleep, like quantity and quality of sleep. There is no shortcuts on this, despite being an exam or whatever. So I mean, sleep deprived persons is actually more impaired than alcohol intoxicated persons is what is commonly quoted, and I think it's true too. After a 36-hour night call and all in US, I remember many times barely able to drive home, but some of my friends had accidents and all, and I wouldn't blame them. Sleep deprivation, obvious sleep deprivation. We all know what are the manifestations, and also no, but subclinical sleep deprivation with all the stresses and all. Personally, also, all of you doctors should take extra care to make sure that you are getting adequate sleep despite the busy schedule, number of patients here, family, too many stresses. And I mean, I'm sure Indian doctors, the lifestyle is, for me in US, it was if I work 1 week, I could get 1 week off and one month vacation because I had to go all the way to India. So I was adequately rested. Even if I could not sleep during my working hours, I could sleep the next week or something for compensation. But even in Indian circumstances, because health is important, sleep, make a conscious decision and never to shortcut on sleep. And coming to the topics of interest, like you have everything from physiology to the latest advances there, so I'll not talk too much about that. But I think I request, like all of you also may be surprised, probably I myself also planning to do a sleep study or something just to see what is my stages and all. So I think when I was last reading about sleep, there was stage 3 and stage 4, but I think Ganesh conveniently has pointed nowadays there is no stage 4 and stage 3 separately. Stage 3 is including both of them. So I mean, REM sleep at one time was thought that, I mean, it is not much restive. It is because a lot of activity is there. I think it is not that important, but now it's completely changed. REM sleep is as important as I would like stage 4 kind of sleep. So both quality and quantity of sleep is important. And in this, especially thanks all of our pulmonary team in Somajuda and Vishesharan and all the pulmonary team who has taken a lot of efforts to organize and get the who is who of sleep medicine to see. Normally sleep conferences, I thought maybe 10 or 20 people will be there, but pleasantly surprised to see people from all over the country and all. But this, like, sleep is really, really important, and you're doing a great message to, spreading the message throughout the country. And we'll be, I think on this occasion, Visheshwaran will talk more, but we'll be launching a state-of-art sleep lab here, just besides a hospital here in the B block, with a proper, like a console room and 2 beds with a person monitoring 24/7, and we'll have a simulation lab and more upgrades in the pulmonary department. Despite people blaming me of favoring pulmonary, I think it's purely from admin point. It's making financial and viable sense. So I think we are supporting that way. But first, I request all of you to take a little minute. If you have anything about sleep, or even if you don't have any symptoms also, no harm in doing a sleep test to just analyze what kind of things are there, and never shortcut on sleep. The only 3 things which increase lifespan other than genetics, I think, is calorie restriction and maybe a little bit of exercise, and then stress reduction and sleep. So these 3 things we cannot compromise for health. So anyhow, I'll not take too much of your time. We have high quality people talking about high quality topics. So I'll ask Vishweshwaran to lead through the rest of the program. And thanks all for the faculty and delegates who have flown all over the country. And if you want a little more sleep, if any sleep deprivation, so in Hyderabad we have, our claim to fame is the best chicken biryani. Now is Ramzan time too. We have good halim and all. I think after that it will be tough not to sleep, despite the high quality lectures. So thank you.